Well, welcome back, everyone. Today we have Dr. Pamela Gardner from the Lima Memorial Heart and Vascular Institute with us to discuss the importance of addressing heart concerns promptly with same-day heart appointments at Lima Memorial Health System. So thanks so much for joining us, Doctor.
Good morning. Thank you.
All right. Well, firstly, now why is it critical to address concerns about the heart as soon as possible?
Well, truth is, we only get one heart, and so we need to take care of it. Once the heart's damaged, sometimes it's extremely difficult to get good function back. So if you are having symptoms of, for instance, chest discomfort, heavy pressure, tight, burning, especially with other symptoms, nausea, sweating, vomiting, that person needs to be in the emergency room. But if these are similar but subtle symptoms, we need to get you in and figure out what is going on. Is it your heart or is it your esophagus? What? And the way that we do that is by a good history, a good physical, and then testing. So the beauty of the same-day appointment is that we can get you in here, figure out with you what your symptoms are, most likely, and then get those tests scheduled. Usually that can happen within the same week, and then have you back within a week or two to go over all of the information and figure out what the next step is.
Right. And doctor, you did mention symptoms. So what specific symptoms or medical needs should prompt someone to seek a same-day appointment for their heart concerns?
Things like intermittent chest heaviness, pressure, tightness, burning, shortness of breath, especially, these are with activity. For my heart failure patients, if their legs are beginning to really swell, their belly gets tight, you're probably holding on to extra fluid. Let's get you in here and figure out what we can do to reverse that before it gets completely out of hand. Palpitations, the atrial fib people will complain of their heart racing and pounding and fluttering. We need to know, is that what it is? Because that is a precursor of a stroke. If you aren't treated with, for instance, a blood thinner, and you're having atrial fib, you're at high risk for forming a clot and that breaking free and going to, especially your brain. So we need to figure out what is it you're having, and then pretty quickly get you on the right medicines and treat and potentially reverse whatever the problem is.
Right. Now, can you tell us a little bit more about how maybe the same-day appointments work?
So when the person's having that type of symptom, they call the office, speak to one of the operators who will get some idea of what the problem is. Sometimes they'll say, you know what, this is acute, you need to go to the emergency room. Otherwise, what they'll do is within 24 hours, usually the same day, get you an appointment, get you into the office. The initial part of the appointment will be with one of my physician's assistants who will, they're amazing, and they will help tease out what the symptoms are, help you define what they are. And then the cardiologist will come in and see you. And together we'll decide what next treatment needs to happen.
All right, and you were just talking about the next treatment. So if a patient needs specific follow-up treatments and procedures after their appointment, how quickly are you able to get them in for the care that they need?
Usually, as I said, the examination, the treatment is going to depend on what the testing shows, and we can get you back into the office usually within a week at most to go over the results. If it's something very serious, we'll call you. And for instance, if you need a heart catheterization, we'll get you in and get that done promptly, sometimes within a day or two.
Right. That sounds wonderful. So if anybody is interested in making a same-day cardiology appointment, the number is on the screen there. And of course, call 911 if you're experiencing symptoms of a heart attack. So doctor, I want to thank you so much for joining us today. I really appreciate it.
Thank you.
All right. Well, don't go away because we have more when we return.